some classmates. Now, in different vessels and parts of the circulatory system, there is different amounts of oxygen associated with the hemoglobin in the blood. Now, in normal physiology, the blood is not completely deoxygenated in some areas, but the amount of oxygen is less. So in which of the following blood vessels is the blood more deoxygenated than in other blood vessels is this question. Now, the pulmonary veins are the large vessels carrying the blood from the lungs back to the heart, taking the blood from the lungs to the left atrium. And in the lungs, the blood is oxygenated. So the blood in the pulmonary veins is going to be highly oxygenated. And indeed, in you at the moment, that blood is probably going to be about 98, 99, even 100% saturated with oxygen. Now, the blood from the left atrium goes through into the left ventricle. And when the left ventricle contracts, that pumps the blood out into the aorta. This is the main systemic artery carrying oxygenated blood to the body. And the carotid arteries are the two large arteries in the neck taking blood up to the head that derive directly from the aorta. So they also contain highly oxygenated blood. This means the correct answer to this question is B, the pulmonary artery, because the pulmonary artery leaves the right ventricle. And the right ventricle gets its blood from the right atrium, which is receiving the deoxygenated blood from the systemic veins, from the veins draining the body. So the blood in the pulmonary arteries is the least oxygenated. And typically this blood is something like 75% oxygen saturated. So the oxygen saturations in the blood in the pulmonary artery are going to be significantly less than the more highly oxygenated blood in the systemic circulation going to the tissues of the body. So the coronary arteries are supplying blood to where? Just pause if you need a little time to answer this question before going on to the answer. Well, the A option here is really a little bit silly. There's not a particular blood vessel carries blood to the left or the right side of the body, so we can dismiss that. Now, the right atrium is receiving blood from the systemic veins directly from the inferior and superior vena cava, so it's not that. And the left atrium is receiving blood from the pulmonary veins, so it's not that. And the coronary arteries are actually the arteries that supply blood to the myocardium directly. The myocardium is the contractile muscle of the heart. It's actively contracting every time your heart beats. So it needs a lot of energy, it needs a lot of oxygen. And that is supplied in the blood from the coronary arteries. And the right and the left coronary artery derive directly from the aorta. So the correct answer is that the coronary arteries supply blood to the myocardium. Now, gaseous exchange describes the process whereby oxygen goes from the blood into the tissues and carbon dioxide generated in the tissues during metabolic processes goes back into the blood. So just where is it that this process is taking place? Now, the main site of gaseous exchange is the systemic capillaries. The systemic capillaries have very thin walls and there's untold billions of them, giving a very large internal surface area. So this is the primary site of gaseous exchange between the blood and the tissues. The arterioles are the very small vessels taking blood to the capillaries, and the venules are the very small vessels carrying blood away from the capillaries. Now, there is going to be gaseous exchange in the pulmonary capillaries, but it's going to be the other way around. This is not between the blood and the tissues. In fact, what's going to happen in the pulmonary capillaries is the carbon dioxide is going to diffuse from the blood into the alveolar air spaces, and the oxygen is going to diffuse from the alveolar air spaces into the blood. And of course the pulmonary capillaries are themselves located within the lungs. Now in normal physiology, the heart muscle, the myocardium, is going to contract when it is electrically stimulated to do so. But this question says, is the electrical activity for the contraction of the heart is initiated where? So where does this impulse for the contraction of the myocardium come from? Now the heart actually generates its own electrical impulse for its own contraction. And this is what actually makes heart transplantation possible, because you can take a heart out of a donor, put it into a recipient, and it will still carry on beating, even although it is not connected to the nervous system of the recipient. So the answer here is the sinoatrial node, which is an area of intrinsically electrically unstable tissue, specialized myocardial tissue, located in the right atrium that generates the rhythm for the heart. Sinoatrial node, or SA node, it's known as the pacemaker. Now the atrioventricular node is the node between the atria and the ventricles. That regulates the flow of the electrical current from the top chambers of the heart, from the atria, down to the ventricles. Now the medulla oblongata is the lower part of the brain stem that does contain a lot of the autonomic areas of the brain. The autonomic nervous system being those parts of the brain that work automatically outside the control of the will. Now sympathetic stimulation from here will speed up the heart, and parasympathetic stimulation will slow down the heart. But it remains true that it's the sinoatrial node that generates the rhythm of the heart itself. Now, the individual myocytes will generate an electrical current, but they will do so at a much slower rate than the atrioventricular node. So some isolated myocytes on their own are quite capable of generating electrical current and initiating contraction. But this will be at a slower rate. And the rate of the heart is set by that which is depolarizing fastest, that which is generating the electrical impulses faster. Now the motor cortex of the brain is in the frontal lobe, and that's responsible for movement of all areas of the body that are under the control of the will. And clearly the heart is not under the control of the will, it's controlled by its own intrinsic electrical activity, albeit moderated by the autonomic activity from the medulla oblongata. Now the heart contains valves, and the purpose of a valve is to ensure one-way flow of blood. Blood should only go in the physiological direction. If blood goes back in a direction which is not physiological, it goes in the reverse direction to which it is supposed to go. That is called reflux. So the function of the mitral valve is to prevent reflux of blood from the. And I'm going to give you a clue here. The mitral valve is also called the bicuspid valve. So the key here is to understand that the mitral valve, or the bicuspid valve, is the structure between the left atrium and the left ventricle. So during venous return, during diastole, blood is going to come back from the pulmonary veins and go straight through the mitral valve into the left ventricle. And then when the left atrium contracts, that's going to contract, increasing the pressure in the left atrium, ejecting more blood through into the left ventricle. That phenomena is called atrial kick, and it fills up the ventricles somewhat more, expanding the myocardium to increase the strength of the next ventricular contraction. Now, if there's mitral regurgitation, when the left ventricle contracts, blood will go back from the left ventricle into the left atrium. Now, this is not supposed to happen. When the left ventricle contracts, the mitral valve is supposed to slam shut, making that noise we call a lub when we listen to heart sounds. But at the same time, the contraction of the left ventricle should open the aortic valve, allowing the blood to go out into the aorta, into the systemic circulation. So the answer is C. It prevents reflux of blood from the left ventricle into the left atrium. It doesn't go back into the left atrium. If it does, of course, that's a pathological condition. It's called mitral regurgitation. So this question is really about histology. Histology is the study of the tissues. And endo means in, and cardium is to do with the heart. So we're talking about the inner layer of the heart. Now, what sort of tissue is the inner lining endocardial layer composed of? Now, because large volumes of blood are flowing through the heart, we want that blood to be able to flow through easily without generating any turbulence. We don't want any whooshes that might be caused by turbulence. So it's very important that the lining is smooth. So if I give you a rough, lumpy surface to walk over with roots and ploughed fields and different rough things in the surface, you're going to find it difficult to walk over that smoothly. But if I give you a nice flat floor to walk across, then you can walk easily across that because it's nice, smooth and flat surface. And it's exactly the same with the passage of blood through the heart. So the endocardium is made of smooth, squamous endothelial cells. Squamous means flattened. It kind of comes from squashed, squamous, squashed, but the cells aren't squashed, of course. They're supposed to be flat cells to allow the blood to go over easily. Endo means inside, and thelial relates to epithelium, a lining tissue. But it's lining the inside of the heart, so it's an endothelial tissue. Endo, in, thelial, lining, inner lining of the heart. Now, I know that superficially this can sound like a very simple question to define an artery, but it actually causes quite a lot of confusion. So when we're learning about anatomy and physiology, it's really good to learn these simple definitions at the start of the process, and that will set us up for understanding more complicated concepts in the future and set us up for understanding the clinical problems when things go wrong as well. Now, the definition of an artery or an arterial vessel is very simple. It's nothing to do with whether it's carrying oxygenated blood or whether it's carrying relatively deoxygenated blood. An artery is simply a vessel that carries blood away from the heart. So after the last question, this one might not be too difficult. But try and get it right so we get your percentages up a bit. Likewise, the definition of a vein is nothing to do with whether it's carrying oxygenated or deoxygenated blood. A vein or a venous vessel is simply a vessel which is carrying blood towards the heart. So here's another question testing our understanding of the anatomy and particularly the histology of the tissues that the heart is composed of. Now, the layer of the heart, which is composed of tough, strong, fibrous tissue, is the outer layer. And this outer layer protects the heart from physical damage because it's tough, fibrous tissue. And as well as that, because it's tough, fibrous tissue, it is not elastic and not stretchable. And this is on the outer layer of the heart, surrounding the outside of the heart. So it's going to restrict overfilling of the heart. So when the heart fills to a particular amount, it'll reach this pericardium on the outside, and that will prevent pathological excessive dilation of the heart. Now, peri means round the outside, perimeter, cardium, heart. So the pericardium is that layer which surrounds the outside of the heart, the perimeter of the heart, if you like. Well, if you've just gone through the previous questions, your options for this one are slightly narrower than they were a few questions ago. The layer of the heart composed of cardiac muscle, the contractile layer of the heart. So the myocardium, myo means muscle. It's the prefix that means muscle, cardium, heart. So myocardium, muscle of the heart. The contractile layer made of individual myocytes but connected together in a very clever way that allows the electrical activity to spread across the myocardium, initiating its contraction. So the heart has 4 internal chambers, the left and right atrium and the left and right ventricles. But which chamber of the heart pumps blood into the pulmonary artery to go on to the lungs? So remember, the left heart is the body pump. Left heart, body pump. The right heart is the lung pump. And the atria are the receiving chambers, so the right atrium is going to receive blood from the venous systemic circulation via the inferior and superior vena cava. But it's the right ventricle, it's the ventricles that are the pumping chambers, so it's the ventricle, the right ventricle, that's going to pump blood into the pulmonary arteries to perfuse the lungs. Now, I'm pretty confident with what we've just discussed you should be able to get the answer to this one correct. So as we said, it is the ventricles that are the pumping chambers. So the chamber of the heart which pumps blood into the systemic circulation is the left ventricle. It's the left side of the heart that is the body pump. Now, systemic means that the blood goes to all the systems of the body. So from the left ventricle, the blood is pumped into the aorta, and from there it goes to the brain, it goes to the intestine, it goes to the kidneys, it goes to the liver, it goes to the endocrine glands, it goes to the systems of the body. It's the systemic circulation. Okay, I've already told you the answer to this one, but get it right to keep your average up. So the superior vena cava is basically draining the top half of the body, and the inferior vena cava is draining the top half of the body. Vena relates to venous, and cava means cavernous. It's a large, wide vessel. These are large, wide vessels because they're the main systemic veins. And they're draining blood back into the right atrium. And of course, from there it will go through the tricuspid valve into the right ventricle and be pumped into the pulmonary arterial circulation to go to the lungs in order to be oxygenated. So which chamber of the heart receives blood from the pulmonary circulation? In other words, where does the blood go in the heart when it comes back from the lungs? So once the blood has circulated through the pulmonary capillaries, it goes into pulmonary venules and on into progressively larger veins. And 2 pulmonary veins are going to drain the right lung, and 2 pulmonary veins are going to drain the left lung. And both of these are going to drain into the left atrium. From there the blood will go through the bicuspid or the mitral valve into the left ventricle before being ejected into the systemic arterial circulation. So where is the sinus rhythm generated? We've actually asked this question in a somewhat different way already in this quiz, so you should be able to get this one. Now, a sinus rhythm is so called because it is physiologically generated by the sinoatrial node, the pacemaker of the heart. And this sinus rhythm really relates to the heart as it's seen on the electrocardiogram. And it has a P wave followed by a QRS complex followed by a T wave. So the sinus rhythm generated by the sinoatrial node has a PQRST in the right order and is fairly regular. Now ECG and EKG are the same thing, electrocardiogram. And this question tests your knowledge of the waves seen in the electrocardiogram. So we don't want to see a P wave after the QRS complex. The P wave comes before the QRS complex. It's PQRST, just as in the letters of the alphabet. Now, these don't stand for anything. The P, Q, R, S, T are just arbitrary letters that have been assigned to the wave complexes, the electrical activity as seen on the surface of the body as a result of the myocardial electrical activity. A 0.3 second gap between the P wave and the QRS complex would be too long, so it's not that one. And a 0.05 second gap after the T wave before the next P wave would certainly be too short an interval, so it's not that one. Now, this question is testing your knowledge of the circulatory system rather than the heart itself. And I'm just going to tell you that systemic capillaries are the capillaries in the tissues of the body, anywhere in the body apart from the lungs. Pulmonary capillaries are the capillaries in the lungs. So you'll find systemic capillaries everywhere in the body except the lungs. So there's going to be systemic capillaries in the brain, in the myocardium itself, in the intercostal muscles, in the liver, in the bowel, in your toes. They're all going to be systemic capillaries. Now, the systemic capillaries are surrounded by tissue fluid, and this is essential because the oxygen has to diffuse from the blood in the capillaries through the wall of the capillary, and in order to get to the individual cells that need the oxygen, it's got to diffuse through a medium, and that medium is the tissue fluid. So tissue fluid is the essential diffusional medium through which oxygen must diffuse to get from the blood into the cells, and through which carbon dioxide must diffuse in order to get from the cells into the blood. Now, the tissue fluid is formed at the arterial end of the capillary. It comes out of the capillary into the tissue spaces to form the tissue fluid into the interstitial spaces. And then it circulates over the cells of the tissues and is reabsorbed at the venous end of the capillary. So this is an extra aspect of the circulatory system, this microcirculation of tissue fluid. So the tissue fluid is formed at the arterial end of the capillary is the correct answer. Now, it's true to say that there are two circulatory systems in the body. There's the blood circulatory system, and there's also the lymphatic circulatory system. And this question is testing your knowledge of the lymphatic circulatory system. Now, what the lymphatic capillaries are doing is they are collecting excess tissue fluid. Do you remember this tissue fluid we talked about that's formed at the arterial end of the capillary and reabsorbed at the venous end of the capillary? Most of that is reabsorbed at the venous end of the capillary, but the component of it that is not is absorbed by the lymphatic system. And also, when there's things in the tissues that aren't supposed to be there, like cancer cells or bacteria, they're also collected by the lymphatic capillaries. And when proteins escape from the blood capillaries and get into the tissue spaces, these proteins are also drained by the lymphatic capillaries. And the lymphatic capillaries are blind-ended, and they drain lymphatic fluid from the tissues. So when the fluid is in the tissues, you would call it interstitial fluid. But then as soon as it goes through the cells that line the walls of the lymphatic capillary, then it's in the lymphatic system and it becomes lymphatic fluid, draining the excess fluid from the tissue, draining proteins that have escaped from the blood, from time to time draining bacteria that are infecting the tissues, and unfortunately from time to time also draining cancer cells which have arisen. So if you're an average sized adult whose ideal body weight is around 70 kilograms, how much blood will you have in your circulatory system as we're speaking at the moment? Now, typically we say an adult has about 5 litres of blood, but we can work it out more physiologically than this if you want to. Men who are of ideal body weight are going to have about 75 mils of blood per kilogram, whereas women of ideal body weight are going to have about 65 mils of blood per kilogram. Now, why have men got more than women? What do you think the reason for that is? Well, it's to do with the relative mass of muscle. Men are more muscular than women. More of their body weight is made up of muscle. And in women, more of the body weight is made up of fat. That's just the way it is. That's the normal anatomy for men and women. So men that are overweight, they're not going to have another 75 mils of blood per kilogram of extra fat, because the fat has less blood perfusing it. So fat people, people with obesity, are going to have proportionally less blood per kilogram. Now, children, especially young children, we normally compute their blood volume at 80 mils per kilogram. Neonates, newborn babies, 85 mils per kilogram. And if babies are premature or fetuses, they have more blood in terms of mils per kilogram. So simple weight of the patient, get your calculator out and you can work out the blood volumes. Well, this is the last question in this particular video. In which of the following vessels will the blood pressure be highest? Now, the blood pressure is the pressure of the blood against the walls of the vessel in which the blood is contained. That is what blood pressure is. So in which of the following vessels will the blood pressure be highest, do you think? Well, you probably know that veins have a much lower blood pressure than arteries. So the pressure is going to be lower in the pulmonary veins and in the inferior vena